Hello friends. In the previous class we are discuss about shocks, types of shocks, causes of shocks and pathophysiology of shocks. In this class we are discuss about clinical manifestations of shocks, diagnosis and management of shocks. So let's start the lecture. Clinical manifestations. Clinical manifestations vary based on the type of shock, but common symptoms include hypotension. Low blood pressure is a hallmark sign, leading to inadequate perfusion of vital organs. Tachycardia. The heart beats faster to compensate for decreased blood volume or pressure. Pale, cool, clammy skin. Reduced peripheral perfusion causes pallor and a cool, clammy sensation. Altered mental status. Confusion, restlessness, or even unconsciousness can occur due to inadequate oxygen delivery to the brain. Weak and rapid pulse reflects the heart's attempt to maintain cardiac output despite reduced blood volume. Shallow and rapid breathing. Increased respiratory rate aims to enhance oxygen exchange, but it may not meet the body's needs. Decreased urine output. Kidneys conserve fluid in response to low blood flow, leading to reduced urine production. Thirst and dry mucous membranes. Compensatory mechanisms trigger a sense of thirst, while dehydration causes dry mouth and mucous membranes. Nausea and vomiting. Reduced blood flow to the digestive system may result in gastrointestinal symptoms. Anxiety and agitation. Patients often experience a sense of impending doom or anxiety. It's crucial to recognize and treat shock promptly to prevent organ damage and improve outcomes. Diagnosis of shocks. Diagnosing shock involves a combination of clinical assessment, medical history, and various diagnostic tests. Here are key aspects of diagnosing different types of shock. 1. Patient history and physical examination. Gathering information about the patient's medical history, current symptoms, and any potential triggers. Conducting a thorough physical examination to assess vital signs, skin appearance, mental status, and signs of specific organ dysfunction. 2. Blood pressure measurement. Monitoring blood pressure is essential to identify hypotension, a common characteristic of shock. 3. Heart rate monitoring. Evaluating the pulse rate to identify tachycardia, which is often present in response to decreased perfusion. 4. Laboratory tests. Blood tests, including complete blood count, CBC, electrolyte levels, and blood gases, help assess organ function and identify potential causes. 5. Imaging studies. Chest X-rays or other imaging studies may be performed to identify underlying causes, such as pulmonary issues or cardiac abnormalities. 6. Electrocardiogram, ECG or EKG. Recording the heart's electrical activity can help diagnose cardiogenic shock and detect abnormalities in heart rhythm or function. 7. Echocardiography. Using ultrasound to visualize the heart's structure and function, aiding in the diagnosis of cardiogenic shock. 8. Central venous pressure, CVP, monitoring. In certain cases, measuring the CVP provides information about the fluid status and the effectiveness of fluid resuscitation. 9. Focused assessment with sonography in trauma, FAST. This ultrasound-based assessment helps identify fluid in the abdominal or thoracic cavities, which may indicate hypovolemic shock. 10. Lactate levels. Elevated lactate levels in the blood can indicate inadequate tissue perfusion and are often used as a marker of shock severity. The specific diagnostic approach may vary based on the suspected type of shock in the clinical context. Rapid and accurate diagnosis is crucial for timely intervention and improving patient outcomes. Emergency medical professionals play a vital role in initiating appropriate treatments based on the identified type and cause of shock. Management of shocks. 1. Pharmacological management. Fluid resuscitation. Intravenous fluids, often isotonic crystalloids like normal saline or lactated Ringer's solution, are administered to restore circulating volume. The choice of fluid and the rate of administration depend on the type of shock and individual patient factors. Vasoactive medications. In certain cases, vasopressors like norepinephrine may be used to increase blood pressure and improve perfusion. Inotropic agents, such as dobutamine, can enhance cardiac contractility. Antibiotics. In septic shock, broad-spectrum antibiotics are administered promptly to target the underlying infection. Pain management. Analgesics or sedatives may be given to alleviate pain and anxiety, improving patient comfort. Anti-allergic medications. In cases of anaphylactic shock, antihistamines and epinephrine are administered to counteract the allergic response. 2. Dietary management. Nutritional support. Enteral or parenteral nutrition may be initiated in critically ill patients to meet their energy and nutrient requirements. Nutritional support is crucial for maintaining organ function and supporting the body's response to stress. Electrolyte balance. Monitoring and correcting electrolyte imbalances are essential for optimal cellular function. Special attention to potassium, sodium, and magnesium levels is crucial. Blood glucose control. Maintaining optimal blood glucose levels is important to support cellular metabolism, especially in patients with septic shock. 3. Nursing management. Continuous monitoring. Frequent monitoring of vital signs, including blood pressure, heart rate, respiratory rate, and oxygen saturation. Assessment of urine output and mental status to gauge organ perfusion. Positioning. Elevating the legs slightly can assist in improving venous return and cardiac output. Assisting with procedures. Nurses play a key role in assisting with invasive procedures, such as central venous catheter placement or arterial line insertion. Patient education. Providing information to patients and their families about the condition, treatment plan, and potential complications. Encouraging participation in the recovery process and adherence to prescribed medications. Emotional support. Offering emotional support to patients and their families during a critical illness is crucial for overall well-being. Coordination of care. Collaborating with other healthcare team members to ensure a comprehensive and coordinated approach to patient care. Effective shock management involves a multidisciplinary approach, with healthcare professionals working collaboratively to address the underlying cause, restore perfusion, and support organ function. Treatment plans are tailored to the specific type of shock and individual patient needs. Please like, share and subscribe the channel for more upcoming lecture video and go on the description link for information related to this video. Thank you.